But I think the point is that this isn't this isn't the old Chinese restaurant menu where you pick one from column A and one from column B. We need to do all of these things. We want to be helping our employees as much as we can, and we need to surround them with this stuff. And I think that make it easy stuff we can do largely through benefits and policies. And one advantage of benefits and policies is that they reach both active employees and dependents. Your programs, unless they're really exceptional, are not going to have any effect on your dependents. And your dependents represent more than half of your costs in terms of health care. And they also affect things like who gets to come to work. People staying at home with their sick children, or staying at home with their sick spouses. And so, getting the benefit design right is a way to reach dependents. And the other thing that benefits and policies can do is reach everybody. No matter how good your programs are, how involving their programs are, roughly, even the best programs, roughly a third of your people aren't going to do it. They just aren't. They are not joiners. I mean, I work with a dear colleague. We're doing this exercise, this physical activity competition right now. She's totally into this. She does this stuff, but she will not participate in this program. I mean, it just rubs her the wrong way, and she's not going to do it. And so this is a way through things like benefit design and policies to affect the people who are not joiners, if you will. On the other hand, if we want to make it popular and show them how, we can do that via programs, like I heard you talking about when I came in, and communication. Part of what we can do with that is raise awareness. It's astounding to me, we do this work all the time. When we ask employed people about what their benefits are, they have no clue. I mean, when we ask them whether they're covered for smoking cessation or whether they're covered for mammography, they don't know. What's even more astounding to me is when we ask the HR people, they don't know. I mean, and they're the ones who hopefully had to design this and pay for it. I just got my UMP booklet, every January. I got to tell you, I didn't go cozy up with that. So we are going to have to make greater efforts to let people know what is and isn't covered. And again, pointing in the direction. UMP's been doing that for a while now on their coverage of the quit line, and every year they do it, and every year the use goes just like this. They just get this huge spike in use of free and clear. My question is, why don't they do it every month? They just do it once a year. And I don't know what when they would quit seeing benefit from that, but they could at least try doing it twice a year. And then ultimately, we're trying to change culture here, and it is not easy to do that. And we've got to, I think, use all of the tricks in our arsenal to do that, and that includes and that certainly means we need to do social involvement things, these programs, and communication that again points people towards the norm. And that's a theme I'll come back to. How am I doing? Okay. So what I've done up to this point is talk to you about the Guide to Community Preventive Services, and I've talked to you about a lot of whats, if you will. Let me talk to you about some hows, because there was another really neat piece of work, a very, very expensive, comprehensive review of what works to help things get implemented in settings like, complex settings like our workplaces. And there's 7 things on this list that they end up recommending that I want to go through with you. One of them is create champions. That's what you are. I heard you're all champions in your workplaces for workplace health promotion. And we don't need to do research on that. It's quite clear that champions make a difference. And of course, we'd love to clone you, right? We'd like to see many more champions than you in your workplaces. And I know that that's what you're trying to do. So we want people who know about this stuff and are exhorting other people to do it in a positive way. Second thing is social networks. Part of what we have in the workplace are natural social networks that form around where people work. What group they work for, which office, are they lawyers, are they accountants, are they administrative assistants? But there are other things that people relate to. Maybe they're Mariners fan groups in your, even these days, maybe they're Mariners. Or maybe people relate based on race or ethnicity. And we need to be getting on the forefront of each of those agendas with our health promotion agendas. A short list of things we want to see people do. Training. training, training is a way to get the word out, and you've all gone through lots of required. At the university somehow we're exempt from these things. I miss them from when I was a Fed, but we don't do a lot of these required trainings. But I know you've gone through a lot of trainings. King County's a very impressive workplace health promotion program. I know you've heard about it. They have gotten about 90-95% participation in their health risk appraisal, and they've gotten about 50% participation in a coaching program. I mean, those are really incredible levels. They've got about 14,000 employees. How many trainings do you think they did in the year they rolled out their program? Anybody want to guess, or have you heard? 14,000 employees. They did 2,000 trainings. So they did one training for every 7 employees. I mean, that's essentially, obviously, for some people they had about 3 people who did this. I mean, that ended up being a lot of their work. I tell you that not to say that that's the standard that you have to reach, because I don't know what the standard you have to reach is, but it tells you kind of an order of magnitude that you might want to be thinking about, and you can compare that to what you've been doing. I mean, I was astounded when I heard that. So it takes a lot to make this stuff happen. Reinvention. So, we're going to go out there and tell people the things to do. We've been doing that, and they're going to tell somebody else, and they're going to tell somebody else, and it's going to get changed. And that's what human beings do. And that's okay as long as they're still on somewhat in the same ballpark. And we need to make sure that we're specific enough and simple enough in what we instruct people to do that it doesn't get changed. So if you have a group physical activity program that focuses on walking and another group wants to focus it on gardening or on dancing, that's just fine, right? That should be just fine. If they want to translate it into echinacea use, honestly, that doesn't wash. And I don't want to go into the pros and cons of echinacea, although I have yet to see any evidence that echinacea. I think we should expect reinvention, and we should actually. It's fine as long as we're actually getting at the core things we're trying to do. Communication. You may not believe it, but communication is one of the things that a bureaucracy like ours is best at. We really actually are good at getting the word out. We have so many means of doing it. We have meetings like this one. We have email. We have posters. I was just in the Department of Health the other day, and there are all sorts of posters everywhere. So we can communicate quite well, much better than smaller employers can. And we need to be, again, keeping this stuff going. It's hard to over-communicate, particularly when it comes to workplace health promotion. Evaluation. You remember, I'm sure you know, we had a program in Washington State in the 80s, and then we didn't have it in the 90s. And I'm not quite sure why it went away, but I think part of the reason it went away was that we weren't sure it was making a difference. We weren't sure what bang we were getting for our buck. So we need to be asking ourselves that now. We need to ask, is this stuff really working? And we need to be measuring that not just at the outcome level, which can be hard, but we need to be measuring, as you were talking about, we need to be measuring at the, do they even know about it level? And at the, are they doing anything level? Are they using that blood pressure monitor? Do they know about it? Are they using it? And then finally, at the, is it making any difference in anybody's blood pressure level? So the levels you laid out are very important and right. And last is resources. This stuff is expensive, and I'll harp on that a little bit more. But you can't just kind of wave your hand and say, "We did it. We had a health fair. It's all over. Everybody's healthy."